I'm Dr. Leslie Citrome, Clinical Professor of Psychiatry and Behavioral Sciences at New York Medical College in Valhalla, New York. And with me is
Dr. Jonathan Meyer, Voluntary Clinical Professor of Psychiatry at the University of California in beautiful San Diego. Okay, here we go. Our first round of questions begin with, will an antipsychotic, and the first one is, show up on a drug test? Modern methods, I think, really help solve all of these issues. Maybe with older assays or the quick and dirty ones in the clinic, you might get a false positive, although I can't think of which agent might possibly. Clozapine has a structure which is possibly allied to benzodiazepines, but everything these days usually gets mass spec, gas chromatograph confirmation, and those should always be negative.
Well, let's go to the second question here.
Will an antipsychotic make me lose weight? Well, there's two ways to answer that. I'll answer it from the perspective of somebody who is antipsychotic naive, and I would say universally the answer is no. Sadly, even those agents we think are mostly more weight benign, you give them to 18-year-olds, they tend to gain some weight. And I never promise anyone that they're going to lose weight if they've never been on an antipsychotic. But what if somebody's already been on a medicine? Might they lose weight?
Well, that's a great point, because if someone's been, let's say, on a medicine that's been associated with weight gain, when they switch to another antipsychotic that is less associated with weight gain, they might actually lose some weight. So there's something I do in my office with every patient when they come in, and that is weigh them. My scale is right next to the door. There's no way of missing it, and I weigh everybody. That way I don't have to check when I last weighed them, and I'm on top of this.
Very good. Next question. Will an antipsychotic help with pain? It's an interesting question. I can honestly say it's not something I've processed as a concern. We know, as many of you understand, antidepressants, which have dual mechanisms, serotonin and norepinephrine reuptake inhibition, and the NRI component in particular is very helpful with neuropathic pain. As far as antipsychotics go, I'm going to say I have not heard of any data which would suggest it helps with pain. Have you?
I have not, but it could help people feel more comfortable, sleep better. They may be in less pain.
There you go.
All right. The last one on this board is,
will an antipsychotic work for TRD? Well, we appreciate the fact that many people who fail the traditional monoamine reuptake strategies end up on adjunctive atypical antipsychotics. To the extent that those people could be characterized as treatment resistant, I think we would say the answer is yes, but it's limited to a small number of medications, all of which has been studied for this purpose and have shown value. As a broad statement, I would not say being an antipsychotic means you'll work for TRD. You have to have certain properties. And what properties might those be, Les?
well, if we go back and see what the FDA has approved for TRD, it does include one of the antipsychotics, combined with a very specific antidepressant, and that's olanzapine-fluoxetine combination. And the reason it's specifically approved for TRD is it was studied in patients with TRD. It's not to say that the other antipsychotics wouldn't work in a similar way, but it wasn't exactly studied in that fashion. We think the antipsychotic does something in addition to the antidepressant. It may be 1 + 1 = 3, or 1 + 1 = 2. Whatever it is, you have at least an additive effect in terms of the mood. Thank you for joining us at NEI's Autocomplete.